Welcome to Studying for FRCS. This is Sai from the Mindful Learner, and this is part 2 of the my series of how to prepare for part 2 examination of the general surgery, and where we answered the question of how do I prepare. Now, how do you prepare for the part 2 examination? And the principles are the same as before in part 1. We study the material and then we practice. And it is actually practicing that is the most important part of this preparation. You have to be able to verbalize, and the more you verbalize, the more it will become a second nature to you, and the more you will be able to answer more fluently. So, first of all, studying the material, and again, you can refer to the companion series for the books, which you should have been done by part 1 if you've not done, and if you have time, do that. The guidelines, you need to have up-to-date guidelines, especially for your own specialty and also for the general surgery and emergency surgery. So these are the three things you must consider. To help you with that is webinars and podcasts like Behind the Knife, and my own podcast Studying for FRCS, where I have recorded my notes about how I will answer and how I will not. You can also use similar things like that. But the main thing is, of course, practice. Now, the resources for this examination, there are courses, there are lots of courses. There are Alpine courses, Whips Cross courses, and then there is also Christie courses. So a lot of them are there, and they're all very useful. This is not a sponsored video by any of those courses, and I'm not affiliated with them, so I will not mention any particular name. A lot of people ask me whether it's worth to doing any courses or not. Now, I have only done one of the course. I know a lot of people who has done all of those courses basically, and it is retrospectively, I would say, maybe not, but when you're going through the examination, it is such an expensive examination, so any bit of help would be helpful, isn't it? So I would recommend do at least one course, whichever is financially and time-wise feasible to you. I don't think there is any point of doing all the courses together because I don't think it makes much difference, but by all means, I can be wrong. However, in my personal experiences, and I have known, when I was practicing with other people, I've known people who had done multiple courses, and some of their preparation and knowledge was, I would say, I won't say as good as me, but I would have expected them to have better knowledge basically for that. Or more importantly, because the courses can't give you a knowledge, but more presentation or more, better presentation of delivery. So that is the most important thing basically. So whichever course you do, what I would advise is to rely on the delivery, because your presentation, the slickness of your delivery, that is the one that is most important. The other thing, of course, resources. So there are two books that I've commonly used, and one is by a book called by Bhaskar, and other one is by a book called Cracking. And these are very useful when you're practicing among groups, because obviously you need a reference and you need a scenario. I will say that I have done most of the scenarios of these two books, especially Bhaskar I have done completely, and Cracking I have done about 75%, I will say, and they are both very useful books. So those two are the materials I have used. And also speak with other people who have gone through examination. What was their experience like? And what questions did they face? And it's not necessarily, they're not going to ask you directly about this and that, just like in part 1 examination. You are a consultant, so they will want to see your way of thinking and how you're thinking about it. So a very important thing that I've seen in one of the examiners saying that, you're not a registrar, so stop thinking like a registrar. You are a consultant, so start thinking like one, and you have to demonstrate that you are thinking like one. So For books, I would say that, and for courses, I would also recommend you to do the courses. So, well, at least one, I would say. I won't go, I think even if I had the money and the time, which I didn't, I wouldn't go and do all the courses together, because I think that is just a waste of a lot of money. And the most important thing you can do is practice. So now, how do you practice? And I believe this is where, like everything, this is where you need to focus on. It's not just gathering the knowledge, but it's about how you practice. So, how do you prepare? So, this is, like I said, and I can't refer enough, this is like a sportsmanship, okay? This is like a game. You have to practice. And how do you practice? You practice again, you make a support group, you find like-minded friends, and that is why, you can find like-minded friends in, that is one of the reasons actually I went to course, is because at that time, none of my immediate vicinity people was sitting for exam. So I wanted to meet with some people who can probably sit for the exam and then whom I can practice with. So for those things also, courses are useful. And but like anything, if I'm to, paraphrase fencing, you are only as good as your opponent. So if your opponent, or if your practice buddy is not that great, you will not be that great. So choose your practice buddy carefully. I'm not saying to be, snobbish or anything, but choose someone who has the same level of commitment as you, who wants to pass as much as you, and who wants to put on the time and the effort as much as you, but also who wants to put on, is ready to share their time and their resources as you. And this is very important, because that group is really going to be your support material. And if you practice with the group, you won't get a consultant or anyone to practice all the time. But if you practice among each other, and if you are brutal with each other, so don't be all nicey nice, be brutal, that your attitude is coming across that. And right nowadays you can practice. I mean, I've practiced on Teams, I've practiced on Zoom, I've practiced on WhatsApp, whatever I could get, anyone who was available at any time, I would practice with them. And I've actually made 2 different groups, because I find that, like I said, people were not matching my commitment level. I would, unless I am on call, or unless I am, physically, electively operating, I will always be ready to be there to, to practice for Viva sessions. But other people will not be. They will have, some people will have, it's different, your priority. So that's very important that you include that. So that is why having 2 groups helped me, that, if one group was not available, I could do it with another group, and I could get maximum out of it. And also, the more different people you practice, the more different people, you get used to of their approach, because the examiners are like those people. And we used to practice scenarios from the books. That's because, the scenarios have an answer. So this will give us some sort of a baseline of how we answer. Next is time yourself. So as I've given you the time, so the clinical scenarios are about, long cases 20 minutes and the short cases are 10 minutes. The oral boards, basically, where you have half an hour for each board, one examiner will ask you about one segment, the other examiner will ask you about one segment. And most commonly, they will ask 3 scenarios in a 15 minutes time. So you have 5 minutes to answer questions. So time yourself, and actually if you time yourself, you will see that you can, when we didn't used to do it initially, but when we actually timed ourselves, especially I would have the timer on for myself also. So what we used to do is that I would set the timer on, and I will ask my colleague about the questions and everything. And then they will set the timer on and they will ask themselves a question and everything. But when I would practice, as in like I am the examinee, I would always have the timer on, because that gives me an idea of how much 15 minutes is, how much things I'm going through. Because remember, ideally you're meant to, they will move you to 3 scenarios. The examiners want you to move to the next question and the next scenarios. So once they have that done, once that 5 minutes is done, they'll move you to the next scenario. So as much as question you can answer within that scenario would be good for you. And the other thing that I've noticed is when I was practicing with some people is that they would use a lot of filler words. So in the exam, remember, you are a consultant. So if you go by saying, oh, I will take a clinical history, I will start by asking how the patient is, duration of the symptoms, how the patient felt, does this patient has any, this is not MRCS, this is FRCS. You know how to take a history. If the examiner wants you to elaborate on the history, which they will probably on a clinical history examination, but not on the, usually not on the clinical oral viva. And if they do, they'll tell you that, can you elaborate what you will look for in the history? You have to mention the pertinent points you will look in the history. For an example, if you are taking a history about a patient who has who had probably such as, any pelvic floor disorder, for an example, you need to take a history of that female about her about her childbirth history. So these, if you're talking about a breast cancer patient, you need to take her family history, you need to take her menarche and, specific history relevant to that. So those are the important, pertinent things that you must mention in the examination. And so if you time yourself, you will see that, how much time are you taking just by saying, oh, I will look for these things in the history. So you have 5 minutes. If you have taken 2 minutes just by elaborating yourself on the history, the examiner has no other option but to interrupt you, to make you move on, or if he's not a particularly helpful examiner, they'll just let you go on with the history. They won't stop you. So remember, the examiners are also being assessed for quality. So they are there to help you. But at the same time, you should know how to answer the questions. I will have some materials about how to answer questions in future. So keep an eye out for that. But that is something you really need to work on. So basically your delivery. And the other thing that I found most useful is recording yourself and basically hearing yourself. Because when you record yourself, actually, and that's another advantage of doing it online rather than in person, I will say. When you're doing it in person, it's a different feeling. Okay, especially if you're doing it with a consultant, your palpitations, your heart rate and everything goes up. But when you're doing in an online setting, then you can see yourself. And if you can record yourself, you can actually hear how you sound. And for an example, if, one of the reasons I started this podcast is one is to, summarize all my clinical notes so that I can listen to them, but B, also to improve my content delivery of how I come across. And when I hear myself, I'm not always impressed with some of the recordings or some of the way I'm speaking. I think I do a lot of a lot of, all of that. But that's me at that time, and I've improved a lot from that. So that's what I'm saying, that, this is one of the way you can actually improve your method of delivery. The other thing is make a list of what you need to do and, how much are the questions you need to do, and stick to that schedule. And that's why it's very important. If you stick to that schedule, then you probably won't be able to stick to that schedule completely, but you will have some sort of structure. When I first started to prepare for part 2, I was overwhelmed, like where to start, where to finish. And actually at that time I went to a course and I wasn't prepared a lot, and I was very, very scared. Like, I am not prepared for it. How do I do that? But one of my colleagues who was a new consultant who told me, just go there and you will find that you actually know a lot more than you. And also when you will see other people, you will see some of them are very good delivery and some of them are very poor delivery. And you know what? That is actually true. I had not studied, anything other than my part 1 exam, which was still, about 1 month ago. So, and I have studied a bit, but I also have a full-time job, just like most of you. So, I haven't studied that vigorously as much as I should have in that 1 month. So when I went for the course, I was really scared. But actually, my day-to-day knowledge of, because I'm hardworking and I'm very much involved in my clinical work, was actually a lot better than many of the other of my colleagues. And actually, in fact, most of the mock ones I actually got 7, and a couple of them I got 8. Now the problem is, you can get a self-inflated sense that, oh, you are gonna pass and it's just a very easy exam. It's not that. So I had to keep myself grounded. But that was also gave me a bit of confidence that, you know what, actually I do know stuff. So all I need to do is work on my delivery and work on those knowledges, basically. So make a schedule, stick yourself to that schedule, and also planning advance, like again, if you have on calls, try to swap it. Take all your annual leaves and study leaves during this time. And if you have a helpful colleague who's doing the same, as much as possible, just practice. Even if you do it for 1 hour every day, and you do it mindfully, okay? Don't just do bullshit practice. Do it mindfully in terms of, talking, delivering, remembering the points and everything. You will see that it is so much better. And of course, know the material. So, read the books are useful for that, but also read the guidelines, read the papers. One of the things that I was very much scared of was my academic. I'm not a very academic person. I am not an academia. So, how to critique and everything. So I started, reading journals and reading, critiquing them, and I found some useful tools. And I've also, obviously I can't practice with someone all the time. But I did manage to do practice with one of my consultants, which was extremely helpful. And also I've practiced them to myself, like, how would I deliver and everything. And I think that made a huge difference. Know your guidelines. So look for your specialty guidelines. So in the part 1, I mentioned some websites. So go to them, especially of your specialty. The emergency and trauma, you need to know all of them. So, and all specialty. For an example, just because you're breast, you won't get any mercy in those. Similarly, actually, breast specialty trainees, there's so many research going on. There are so many guidelines that are variable. So it is sometimes really difficult for them. But they actually have a higher retention of passing also, apparently. So just keep that in mind and just know your stuff, basically. So this is my summary of how I prepared for studying for FRCS. And I think the most important bit among all of them is practicing with your study buddy. And so I do have, in the Facebook, I do have a group for studying for FRCS, which is a closed group for people only ready to sit for the exam within 1 year. So if you are really struggling for finding any study partner, you can definitely contact the Facebook group. But also regarding, there is an Instagram account also of studying for FRCS. You can also DM other members, whether anyone is interested, and also the YouTube community, because finding a good partner is paramount, basically. And you want to find a partner who is willing to practice with you, who's willing to give you proper feedback, not sugar-coated, who's actually paying attention when you're speaking, so that they can catch you on your mistakes and you are corrected, and also who's willing to share things with you. So I had one of my study buddies who was, this guy was the only guy among all of us who sat the exam. But other than the fact, he shared his online link for the platform to practice, there's nothing else he shared. And even his previous questions he wouldn't share with us. And obviously this irritates you, because here we are as a group, we are arranging practice sessions with various people, and including him with it, and he's not just sharing with any of it. So, obviously we dropped him in a nice way, but these kind of people, they suck the life out of any practice session. So don't include them. The other type of people don't include in your study buddy is people, and again, not to be snobbish, but people who has probably, it's not about that you have not passed or you have passed in one attempt. It's about what you did after you failed. Like, do you blame the examiners, or have you had a hard look at yourself? Like, what would I do differently? Like this colleague of mine, the one that I mentioned, he would just say that, oh, the examiner wasn't happy. And I would ask him, okay, so how did you answer? Tell us so that we can learn. And he would be like, no, you just need a presence of mind. Well, of course you need a presence of mind, but you also need to have that slickness and delivery. So don't study or try not to partner with people who had previous experiences that they will always blame on the examiners. It might be the examiners, it might be many things in the examination that goes wrong, because at the end of the day, we can work as hard as we can, but there is a bit of luck involved. But the luck factor you cannot change. What you can change is your own preparation and your own mentality and your own hard work, and pray and hope that all your hard work will pay off in a pass, in a good, safe pass. So this is my personal experience whenever I have formed any kind of study groups, basically. So I hope you find this useful. Thank you for listening, and please leave a comment and like and subscribe this channel so that I can help, so that it can be we can help it to grow. Please leave any comments that you have in the comment section, or you can DM me also in the Instagram, and I'll see you next time then. Thank you.